Hi, thank you for being here today and
You're
sharing your
welcome.
experience with everyone who's going to be watching this video. Would you please first introduce yourself?
I'm Barbara McCutcheon.
Perfect. And Barbara, how long have you been a patient of Dr. Prima's?
I've been going to Dr. Prima probably a couple years
A
now.
couple years now. Wonderful. And so tell me what brought you to see Dr. Prima? What symptoms were you having?
Well, about 5 years ago, I started noticing a bulge out of my vagina, and it was getting bad enough that I felt like I needed to take care of it. And at first I went to a urologist, and he recommended a pessary, and I used it for about 3 years, and then I decided, well, there need to be something else done, so then I came to Dr. Prima.
Okay, wonderful. So it seems like you used the pessary for quite some time.
I've used it for about 4 years,
4 years.
more.
And
Yeah.
did it feel like it improved your symptom, or did it seem inconvenience for you?
It improved in the sense that I didn't feel the bulge coming out. It hit, it lifted it up, but it's just a mess trying to deal with a pessary and keep it clean. And I was having to go every couple 3 months to have it cleaned, and then it's just
a lot of maintenance.
Yeah, a lot of maintenance. Yeah.
Okay. And so after that, going to the urologist, and he recommended the pessary, you then seeked other help with Dr. Prima.
Yeah. After 3 years, I realized that I needed to get something else done, and I've chosen Dr. Prima.
Okay. And then what did Dr. Prima recommend for you instead of the pessary?
Well, she recommended surgery, and of course, with the pandemic and everything going on, it was put on hold for a year or so. And then, but she did from the very beginning recommended the pessary or the surgery.
Okay, wonderful. And how long was the surgery? What was your experience like?
The surgery, I went into the hospital, well, the outpatient hospital, about 8 in the morning, and I came home about 6. The surgery, of course, I was scared to death, just like anybody else would be. But it really went well. I mean, I went home, and I had hardly any pain, really.
Awesome.
I did take the pain pills for maybe a day or two, but after that, really no pain. I was careful,
Good.
not lifting and things like that, and it was nice just not to have that pessary anymore.
Oh, yeah, I can imagine.
Yeah.
And so really it sounded like the surgery was only one day. You came in the morning?
Yeah,
and
it was
left that
outpatient. I got to go home that same day, and I kind of rested around for 2 or 3 days, but other than that, I was up, doing things. Careful not to lift and things like that. With any surgery you'd have, yeah.
And now that you're 2 months out of surgery, how are you feeling now?
I feel great.
Good.
I don't have to mess with that pessary, and
Yes.
and I had gotten, probably with the pessary, I'd gotten a couple, 2 or 3, urinary
UTIs.
tract infections,
Yes.
that you just get taking it in and out, and
Of
so
course.
that's eliminated that, and
Good.
I really feel good,
Awesome.
and I just got a clean bill of health today, so I'm great.
Awesome. And so how do you feel like that improved your quality of life now that you don't have the bulge coming out?
Oh, yeah, good, and then not having to deal with the pessary, and then before the surgery, I was leaking a lot, and now I don't have that.
Awesome.
Yeah, that's
Were
great.
you using diapers or pads
I was
before?
using a pad, just those, a light one, but I had to use a pad. So now I don't have that anymore.
Amazing.
So, yeah.
That's awesome. And so how was your whole experience with the office of Dr. Prima?
Very nice. They've been very kind. They've been very pleasant and accommodating, and like it real well, yes.
Perfect. And would you recommend this surgery to any other patient?
If they feel that they want it, yes, I would recommend it, but each person has to do their own thing.
Of course. Well, thank you again for sharing your experience. I'm sure a lot of patients will find it very beneficial.
Well, I think it's very beneficial for me anyway. Yeah.
Awesome. Well, thank you so much for your time.
Okay.